That's that whole making sense
Yeah.
of pain that Peter O'Sullivan's group does such a good job of. And I think I 100% agree. I think sometimes it allows you to get a lot of the compensatory or the kind of secondary changes that happen from dorsal horn to
Yeah.
the brain and all the movement patterns and different things and emotions and thoughts and beliefs and all that stuff. And sometimes when you address that stuff, you're left with a very kind of specific mechanically patterned pain behavior that would suggest
Yeah.
nociceptive things that would benefit from maybe more specific things. So lo and behold, you might treat very locally and specifically at that. I know that gasp from the audience where you might actually do a manual technique at the spot. Now, and that happens, right? And but I think obviously we don't go with the assumption that it needs to
Exactly.
happen. But I think the other interesting thing that I've seen and I love to hear is sometimes you take care of, and that's I see this with Peter stuff, and I definitely see it in clinic where you take the fear and you work with some of that movement behaviors, different beliefs and stuff, and behavioral experience, and all of a sudden there's no need to do anything to
Yeah.
tissues because things are moving and doing great, and
Yeah.
life's good. But I think having a process that can go from that big macro, what's your values, what's the thing that this person's, like you said, limited in life that's they want, and then get back, well, what are the things that are getting in the way of that, and not getting immediately to so micro tissue level of looking big picture, because you can start knocking those things down. Maybe it's through some pain neuroscience education, of course, coupled with other things. Maybe it's through some other things that exposure
Yeah.
based work or some behavioral experiments that you knock those things down. And then, man, the tissues, why monkey with them? The person's happy as a clam. They're
Yeah.
moving great.